news for South Mississippi continues. The 4 o'clock show.
And today, a day to say thanks to our doctors. It's National Doctors Day, and this year, today is more important than ever with the battle against COVID-19. Hospitals like Singing River in Ocean Springs serving doctors a special lunch to show appreciation for all they do. And of course, while COVID-19 cases in our community are much lower now, doctors and healthcare workers are still battling this virus. And Singing River Health System is offering vaccines now at all of its clinics. Joining us now with an update, Singing River Chief Nursing Officer Susan Russell. And Susan, thank you so much for joining us today. And I know it must be a tremendous sense of relief to see the numbers as low as they are right now as far as the new case numbers.
Absolutely, Karen, and thank you for having me today. I was looking over the numbers for Harrison and Jackson County, and they are the lowest I have seen since reporting. Saying that, I know everybody's watching the news and the reports from the CDC about some upswings and upticks in COVID in different parts of the country. We are having a few counties in the state of Mississippi that are having an increased caseload, but we are blessed on the coast that we're still seeing the continued drop in our numbers, and a lot of that is in large part to the vaccination effort.
And let's talk a little bit about the vaccine effort. Of course, it continues to ramp up. Just about everyone eligible now, as far as those who are in the eligible age group, everyone can now get the vaccine in Mississippi. And you all have actually started offering it at all of your clinics, too. So how is that working out?
That is working out incredibly well. We understand a lot of the working public or school-age public can't always make it to those vaccine events, which, you know, honestly, that got quite a few people through very quickly when the vaccines first rolled out. But now a lot of times individuals want to come at a more convenient time or a time that they know they can plan to have a little time off in case they have a few aches and pains or a little headache after some of these vaccines, which we know is a very low percentage, but some people want to be prepared. So by having those vaccines available in all our clinic locations, it's providing the patient with the opportunity to decide when it's a good time for them to have that vaccine and also where it's convenient for them. So really love the fact they have more latitude in what's happening with these vaccines.
I know, Susan, that in the beginning, in the earlier days of the vaccine, the response was tremendous. Are you starting to see it wane a bit? Because it used to be difficult to get an appointment, and thankfully it's getting easier. But are you concerned that not enough people are choosing to get vaccinated now that it's being offered to them?
You're bringing up some very good points, Karen. You know, we know that 15% of the population has had at least the first series of vaccines. Most of the vaccines that are available are the two-step vaccines, and we have seen a little bit of decrease in demand. We think that's because the highest risk patients could not wait to get the vaccines, and that was the older people and people with comorbid conditions. But what we try to encourage everyone is all of us are at risk of either getting the virus itself or being a carrier. So it is vitally important everybody continue those vaccine efforts. And many times I'll hear people say they're waiting for a particular vaccine, of course, Johnson & Johnson, because it's a single-dose vaccine. But I encourage everyone, please get the vaccine that's most readily available for you. Because we do know that, like I said, if you are not a high-risk individual, you could still contract a serious case of this disease, or you could carry it to your loved one. One thing we have learned is the biggest risk isn't from the people that obviously are sick, it's from the asymptomatic carriers. So once again, vaccinations combined with the things we know that work, hand sanitize and wash those hands frequently, socially distance, and wear masks when around others, just for everybody's safety and precaution, are still those good rule advice for everybody to have. If you do contract COVID or you think you have COVID symptoms, please get tested as soon as possible. There are treatments available. I know everyone's familiar with some of the monoclonal antibodies like Regeneron and bamlanivimab that we have given over 800 doses to individuals who otherwise would have probably contracted a very serious case of this disease. So just want people to know we can't let our guards down completely, and we still need to know there are tools at our disposal that will help keep everybody safer and healthier.
All right, so true. Some great points there. Chief Nursing Officer Susan Russell from Singing River, thank you so much for joining us.
Oh, and before I end, just want to wish everybody a happy Doctor's Day. You brought that up at the beginning of the segment. Those guys and women have been nothing but heroes in the last year. So thanks for having me, Karen.
Yes, you're absolutely right. Thank you so much. Mississippi's teachers are now officially getting